Next, we are going to discuss is the thrombus. Thrombus, remember, it is a medical condition that is characterized by formation of thrombus, that is a solid mass within the blood vessels. Now, what is the difference between the thrombus and the blood clot? Well, thrombus refers to formation of solid mass, that is the thrombus within the blood vessels during circulation, whereas blood clot on other hand forms outside the body. And hematoma is the accumulation of blood clot outside blood vessels into the tissues. Now remember that what would be the effect of thrombi? First of all, it can reduce or block the blood supply to organ, leading to ischemia, that is inadequate blood flow, and and potentially cause tissue death, and that is infarction. Now, what is thromboembolism? Thromboembolism, it is a part of the thrombus that can break off and travel through the bloodstream. So when embolus lodge in a distant vessel, it can obstruct the blood flow and that can cause severe complication based upon the location. Now let us discuss about the pathophysiology of the thrombus. The very important part is the triad. Now this concept describes the three primary factors that are responsible for the thrombus formation. The first is the endothelial injury, second is altered blood flow, and the third factor is the remember it's the hypercoagulability. Endothelial injury, damage to the inner lining of the blood vessels, that is the endothelium that normally protects against the thrombus. Second condition like the turbulence or whether the blood flow is slow, it can promote the thrombus formation. The third factor is the hypercoagulability. So abnormalities in blood constituent that increases the clotting tendency. Now, which factor is not a part of triad in the context of thrombosis? The answer would be hypotension. So we know that we discussed that triad, it consists of three factors: endothelial injury, hypercoagulability, and the altered blood flow. So answer here would be hypotension. Another MCQ: which of the following condition is most commonly associated with a deep vein thrombosis? Remember, in prolonged immobility is your answer. Remember, prolonged immobility is the major risk factor for deep vein thrombosis as it leads to venous stasis, that is a component of triad. Now let us discuss the role of the endothelial injury. Now components like the collagen and other connective tissue, they become exposed, that trigger the hemostasis and potentially it causes thrombosis. The second part is the vasoconstriction. Constriction of the blood vessels initially occur to minimize the blood loss. So that could lead to thrombus. The third is the endothelial function. Normally the endothelium, it secretes substances like inhibiting clotting factors like heparin-like substance or promote the clot dissolution. It can release factors that favor clotting. Now there are two types of thrombus. One is the arterial thrombus and other is the venous thrombus. So these are the difference between the arterial and the venous thrombus. The arterial thrombus that occurs in the arteries, that occurs due to the turbulent blood flow and in endothelial damage. So that can lead to myocardial infarction or the stroke. Whereas the venous thrombi, it occurs mainly in the veins. That is the deep veins of legs. That is, it is associated with deep vein thrombosis, and it can cause pulmonary embolism if they travel to the lungs. Now, what are the factors that contribute to vascular injury and thrombosis? So it occurs in the conditions like myocardial infarction, cardiac surgery, etc., and patient with prosthetic heart valves. Atherosclerotic plaque can rupture and expose the thrombogenic material to the blood flow. The hypertension and turbulent flow, it can damage the endothelial cells and promote the thrombosis. Diabetes contribute to endothelial dysfunction and hypercoagulability. So these all are factors, component of cigarette smoke, that exacerbate the endothelial damage and increases the risk of thrombotic risk. Now let us discuss about the role of platelets in thrombosis. We know that platelets, they adhere to the exposed subendothelial collagen at site of injury, and they are facilitated by von Willebrand factor. So these activated platelets, they will release granules like fibrinogen, growth factor. So the platelets, they promote aggregation and result in formation of temporary hemostatic plaque. Now, what is the role of the coagulation system in thrombosis? The first is the intrinsic pathway. So that is triggered by the contact with the abnormal surfaces that activates factor 12, factor 11, factor 9, factor 8 and factor 10 along with the calcium and the platelet factor. The second is the extrinsic factor, the tissue damage that releases thromboplastin, that interact with factor 7 to activate the factor 10. So remember, there is a common pathway, factor 10, that is activated by both the pathways, that forms complex with the platelet factor 3 and calcium. That this complex would convert prothrombin to thrombin. Second is formation of the fibrin. Thrombin converts fibrinogen into fibrin molecule that polymerize into insoluble fibrin fibers. There are protease inhibitors. So these inhibitors should act on various coagulation factors to counteract the formation of thrombin. Example is antithrombin 3. It inactivates thrombin and other clotting factor. Protein C, it is activated by thrombomoludin and it inhibit factor 8A and 5A. Now remember, plasmin, it is a potent fibrinolytic enzyme that breaks down fibrin clot into fibrin molecules. The plasminogen activator, it converts the inactive plasminogen to plasmin. So it has a tissue type plasminogen activator and urokinase like plasminogen activator. So the fibrolytic activity, it helps to dissolve the clot after they have served their purpose. Now discussing the alteration of the blood flow. The turbulence that disrupt the normal axial flow, causing platelets and fibrin to adhere to the damaged endothelium and promoting the thrombus formation. So if the blood flow is slowed down, it allows cells and proteins to accumulate near the vessels and initiating the venous thrombi. Other condition is hypercoagulability of the blood. Conditions like nephrotic syndrome, cancer, trauma, burns, they increase the risk of thrombus. So decreased level of anticoagulants. So these are the various causes of hypercoagulability of the blood. Now what are the morphological features of thrombi? First of all, arterial thrombi, they are typically white and they are attached to the walls. They have consistency firm and pale. Whereas the venous thrombi, they are red and they fills the lumen. They have a consistency soft, red and gelatinous. Mixed thrombi, so these thrombi, they consist of alternating white and red layers that are known as lines of Jahan. So the alternating layers of light staining aggregated platelets and fibrin with a dark staining layer of red cells are the lines of Jahan. So what are the lines of Jahan? The answer is B. The lines of Jahan refers to the alternating layers of platelets and fibrin and red blood cells found in thrombi, indicating their formation under the condition of the flowing blood. So these lines of Jahan, they are prominent due to the rapid deposition of platelets and the fibrin. Other part is distinguish red thrombi from the post-mortem clots. So red thrombi are the antemortem that are formed during life within the blood vessels due to the pathological condition. On a microscope, you would see entrapped red cells, leukocytes and platelets, whereas the post-mortem clots, they are formed after death due to the coagulation of blood in the stagnant vessels. They lack the layer of Jahan and may show more uniform appearance under the microscope. Now the arterial thrombi, remember that they typically lead to ischemia and infarction due to the obstruction of arterial blood flow. And venous thrombi, they can lead to embolism if they are dislodged and cause pulmonary embolism when they travels to the lungs. So example of arterial thrombi, remember it is commonly seen in atherosclerosis and arthritis, and it is linked to conditions like diabetes, Berger disease. So remember all these, Raynaud disease, etc. So they occur in atherosclerosis, whereas the venous thrombi, They occur in lower limb veins, like the deep veins. Example is the legs, varicose veins, pelvic and abdominal veins, pulmonary veins, hepatic and portal veins, etc. Other are the capillary thrombi. They contains minute thrombi, primarily consist of packed red blood cells. They are seen in acute inflammatory lesions and disseminated intravascular coagulation. Now let us discuss about the fate of thrombus. The first is the resolution. So small venous thrombi, they typically resolve completely, while the large thrombi, they may partly dissolve. So the activated fibrinolytic system, it releases plasmin that dissolve the thrombus. If they are not removed, thrombus begins to organize. There would be cellular movement. The neutrophils, macrophages, they appears and phagocytize the fibrin and cell debris. So there would be tissue formation, and there will be formation of granular tissue. The granular tissue would become dense and less vascular and form a scar. So the next step would be recanalization. That means new vascular channels that may form within the organized thrombus in order to re-establish the blood flow. There would be fibrosis, calcification that can lead to formation of flavolids. So sometimes the thrombus can become detached fragment, that are the emboli. They can travel through the bloodstream and lodged into the distant sites, and they can cause ischemia, infarction, or the organ dysfunction. Now, what are the clinical effects of thrombi? There could be the cardiac emboli, thrombi. The large thrombus can obstruct the blood flow within the heart, that can cause the embolism or obstruction to the vital organism, can lead to sudden death. The arterial thrombi, they can cause infarction, ischemic necrosis. Example is coronary artery thrombosis can lead to myocardial infarction. And arterial thrombi in the limbs, it can cause gangrene. The venous thrombus, they can cause the thromboembolism. Emboli can lead to serious complications where they migrate to the lungs or other organs. Now moving to the question, which feature is a distinctive microscopic characteristic of ante-mortem thrombi compared to the post-mortem clots? So the answer is the ante-mortem thrombi, it show packed platelets and fibrin, whereas post-mortem clots, they have a more uniform distribution of red blood cells.